This week on the TelePT Connections Podcast, our very special guest is my good friend, Eric DeYoung. Dr. Eric M. DeYoung is the President and Chief Operating Officer for TRAZER, a movement sciences and health and human performance biotech company. Dr. DeYoung's career background extends into natural health, rehabilitation, and wellness, earning his doctorate in Traditional Naturopathy, specializing in integrative medicine in 2009. He has worked both clinically and operationally with several of the country's largest healthcare companies, including HealthSouth, Kindred, Select Medical, Physiotherapy Associates, Aegis Therapies, Motion PT Group, and he operated his own private practice, the Center for Alternative Medicines. Outside of his healthcare career, Eric is a first responder and sergeant for his local sheriff's office. He has additional training as a Hazmat technician and CBRNE tactical operations technician through FEMA and LSU NCBRT, and supports a specialty Joint Hazardous Response team. Eric's an all-around good dude. He's smart, and he's always fun for me to talk to. I've been excited to do this episode since we started the podcast. I think you're going to like our conversation. Enjoy.
Welcome to the TelePT Connection Podcast. Physical therapy information, innovation, and insights for patients and providers. Physical therapists and innovators Dan Seidler and Adrian Miranda will help you connect with your neuromusculoskeletal system, discussing how to care for every physical ailment they've ever seen or heard of, the latest digital health technology, and other fun stuff from their PT toolbox. Great guests, 21st century home remedies, exercise thumbs up or thumbs down. Now, here are your hosts, Dan and Adrian.
And we are on the air. Welcome to the TelePT Connections Podcast. My name is Dan.
I'm Adrian.
And with us today, we have Eric the Great, Eric the Powerful, Eric DeYoung.
Yeah. Thanks, Dan.
Great to have you, man.
Yeah.
How you doing today?
I'm great. It's always nice to catch up with you and see where these conversations go. Adrian, it's good to connect with you and meet you. I see that you guys are really casual today, so I'm looking forward to a casual conversation.
Casual conversation, professional guy in a casual conversation. That's what we're doing. Yes. How many times have we had conversations, Eric, where at the end I'm just like, we should have recorded this one.
Yeah, right. Exactly. The brain power and the innovation and the crazy ideas.
That's right. Some of them we should not have recorded,
and this is your chance.
This one,
this one will be respectable enough that we should record it.
Yes, sir. So let's just start off with you, man. You've done it all in the rehab world. Give us a quick rundown of how you got to where you are today.
Man, I've had an incredible career. I'm so blessed and thankful to have been an occupational therapist this long. And since it is OT month, I'll shout out to all the OTs out there. Keep doing what you do, and love you guys and girls. So thanks, Dan. I started in healthcare when I was 18. I was in high school. I got tired of fried chicken and fried fish at Long John Silver's, and I decided to go into healthcare. My grandmother was really my motivation. She was a nurse for many years, and I was really excited about going into healthcare. And so I became a certified nursing assistant. So I worked in long-term care, and I went into restorative rehab and got my first flavor and taste of what physical therapy and occupational therapy was all about. So I went into pre-med at UK, really was going to go into physical therapy, did not really care for pharmacology at all. Was looking for a different approach and really hands-on connection with patients. So ended up in occupational therapy because I had a background in mental health and psychology at UK, and really just had a great career. I've been in, like you said, pretty much everything. I've done trauma. I've worked a burn unit. I've been in the OR putting splints on patients for hands and grafts. I worked with the first hand transplant patient in the United States when I was at University of Louisville Trauma Hospital. We had a relationship with Kleinert and Coots hands. So that was a really cool highlight of my career. Went into outpatient. Swore I was never going to do workers' comp, and became the national director of on-site workers' comp for HealthSouth. Started a private practice in ergonomics and then blossomed into integrative medicine. Became the guy that you would go to when nobody knew really what to do with their health. The traditional model really wasn't working. I was really challenged as a practitioner to figure out, what do I do with these patients that traditional medicine doesn't know what to do with. So I was introduced to naturopathic medicine, never heard of it, heard of chiropractic, heard of osteopathy, heard about Chinese medicine, all that. Got into integrative medicine and had a private practice here in Kentucky for 12 years. Sold it successfully and then went back into operations, which I love. I love building businesses, building teams, helping people grow their career. And along the way, went to Motion PT where I met you, Dan. And today went into biotech, which is so crazy. I had no idea I would be in the biotech world. I think some of that is my OT background and working with technology in hands. I was really introduced early to technology and innovation. And so today I work for TRAZER, which is a really cool technology I'd love to talk about more today.
Yep. Can't wait to talk about it. I want to go back a step first.
Yeah.
If you couldn't tell, Eric is from Kentucky.
Was that the accent?
Right? Yeah. It's the accent. No, you said UK a couple of times. I just wanted to make.
University of Kentucky. Yep.
Where is University of Kentucky?
Lexington.
In Lexington. And you live in Lexington?
I live in Louisville, so about an hour.
I get the two mixed up every time I ask you the question. I live in Louisville.
Lexington has cats and Louisville has horses. So theoretically.
Okay, I got it.
Derby season. So I had
Lexington
to put
has cats, guys. It is Derby season. What does that mean? Does it really get crazy there? Like the whole town for a week?
Yeah, so it's actually a 2-week celebration. It starts out with Thunder Over Louisville, which is a huge air show and fireworks. Nice. COVID and some of the civil stuff that's been going on over the last couple of years in this market has shifted really the history here, but it's like the 147th or 148th running of the Kentucky Derby.
Yeah.
And so this year it'll be a little bit different again. It's next Saturday. So it's always the first Saturday in May. And it starts out with Thurby, which is Thursday, which is mostly local folks getting together and really enjoying Churchill Downs. And then we go to Oaks. Oaks Day is on Friday, so the day before the Derby. It kicks off all the beautiful hats and all the beautiful women and all their dresses and the history of the mint julep and all those kind of historical things. And then Saturday is the running of the Kentucky Derby, which is a series of races leading up to one race, which is the Derby. It's the second to last race in the day. Usually goes off around 6:55 in the evening, and that'll be this Saturday. So there'll be 45,000 people in attendance this year. Typically, it's 300,000. So quite a bit of difference with COVID restrictions.
Wow. And I'm saying wow mostly because I didn't know we were getting a history lesson today.
Oh yeah,
that was awesome, dude.
If you want to talk about bourbon, we can talk about bourbon too. So whatever.
All right, we'll get there at the end. Yeah. No, I love the Kentucky Derby. It's definitely one of the great cultural sports events in this country every year. Never been, need to come. Are you going to be working this year?
I do. I work. I've been working. This will be about my 10th year to work for the sheriff's office and in my unique outside of healthcare role. But I do work in kind of a healthcare science team. And so we're there for any type of chemical, biological, radiological, nuclear, or bomb threat, to be honest. So I work with some really smart scientists and radiological folks. And we're just there to make sure that the horses and the backside and all the runners and Derby event goers are safe.
Dude, you're in my speed dial for so many reasons, but that could be the best one. That if there's ever a chemical attack or something bad ever happens to me, my family, or anywhere, the city, I'm calling you first, dude.
Hey, dude, I'm blessed to work.
Your training is unbelievable.
It's really cool. I work with some really talented law enforcement and science related folks.
Nice.
And I always tell people, look, if you see us coming in, run as far as you can, as fast as you can, the other way, right? It's like that bomb t-shirt. If you see me running, you should run too, right?
Yeah.
Get away. No, we're just there to make sure everybody's safe and that everybody has a good time. And, public safety is number one. And in this climate, it's COVID. So COVID's a biologic. So part of our unit's responsibility has been COVID and now COVID vaccine security. So we're part of the healthcare environment when it comes to law enforcement.
That's great, man. Tell us about TRAZER.
It's TRAZER, man. I love technology, and TRAZER has been really kind of the coolest part of my career in the last 5 years now. I was working with a business partner of mine, Kevin Kruger is a physical therapist. He's the CEO of Next Therapy Solutions. And Kevin and I were in the consulting world and outpatient. We got into senior care as a vertical specialty. And we were really looking for technology to, one, set ourselves apart, differentiate, and reduce fall risks. And TRAZER was introduced to us through our kind of a portfolio search. And I was really intrigued by their clientele, the Olympic Training Center, LSU, Arizona, FAU, Alabama. I mean, great teams, great organizations. And I really needed to know more about it. So I got a chance to meet Barry French Jr., the CEO. And we launched our first technology for an outpatient sports medicine center, actually in Atlanta, Georgia, trying to compete with the big teams down there and the big PT groups. And the data analytics, the AI, the ability to just look in front of a camera and the camera measures your body, puts you in a gamified environment on a TV as an avatar, and engages you in 110 different activities that measures your biometrics and your human performance without any kind of connection. We don't have any cords that attach to patients. We don't have any electrodes. We don't have anything that requires setup. It takes 3 seconds to put you in an avatar environment and start measuring activity performance in your body. So it's really cool technology.
How does that work? Everyone is used to the electrodes or the sensors or the wearables. How does TRAZER do it when no one else can?
I'd just like to acknowledge your entrance, Eric, when he was like, tell us about TRAZER. Like, you just got right into it. Like, I've never heard anybody like talk about their company in such like right to it. Like, it's a great company. And then you just went into it. So I think that's pretty impressive, right off the bat.
I love it. So it's an incredible story. So Barry French Sr. is an inventor and kind of a pioneer when it comes to free space movement. And he had over 30 different intellectual property inventions and patents over the last 40 years. They were at Disney World and Epcot Center in their innovation space with their very first TRAZER technology, which was about the size of a small Volkswagen bus.
When was that?
And that was back in the 80s.
Okay, so this is Barry. We know Barry French, the CEO of TRAZER. This is Barry's dad.
His dad. So he was inventing.
Amazing.
So his mom and dad really had 41 years of biotechnology inventions. And they were really ahead of their time. I mean, so far ahead of their time that it took time for software and hardware to catch up with the ideas. I mean, TRAZER was really invented with the idea of it's tracking laser. So these laser beams that came out of this device that was being captured on a belt buckle. And so you talk about, that was the very first invention that didn't have any electrodes. They were using light and lasers to be able to measure human behavior and human performance in this camera.
I feel like that's the technology from like the what's called
Connect.
No, I was going to say when indoor laser tag.
Laser tag, right? So
right. I mean, obviously this is different application, but that technology is how they started.
Yeah. So being able to use a laser and cameras to capture human behavior performance and put you on an environment, a gamified environment.
Yeah, that's amazing.
They were the ones who invented all that, right?
That's amazing.
Like, in Rocky IV where Drago is punching on that device that measures your force output. Yeah. Well, basically Barry Sr. invented that. Right. So they started in the martial arts world and they started lots of different types of technology and evolved into TRAZER. So TRAZER today is a really compact version of its original, very large, not really consumer, a viably available product. So today it's consumer viable. They spent the last 5 years really testing the market with the best of the best, the elite Air Force and Special Forces and Army bases around the country and concussion management, TBI recovery, the best D1 sports programs. The last 6 national championships in D1 sports all have TRAZER in their training centers. The Olympic Training Center has TRAZER in their training center. Some of the top best physical therapy programs in the United States. Some of the best, biggest, largest senior living communities have TRAZER to try to help with falls prevention and senior activities. So that's what I was really first interested in, was like this great portfolio. I mean, they have the best of the best. Yep. What is this technology? And so that's kind of my passion, Adrian, when I talk about it, is coming from who I've seen them work with, the performance output and the engagement. And I was really looking for value-based services. We're kind of in the physical therapy space. We get paid for fee for service and insurance companies measure our success. I needed a technology that was going to help stand us apart, be a differentiator, but measure the validity and value of therapy so that we could continue to prove our value to insurance payers. And that's where kind of TRAZER came into my world and why I became their number one customer. And now I'm their president.
It seems like, I mean, I'm sure you have the data to prove the outcomes are successful, but I think the difference is, from hearing you talk and a little bit I've researched with TRAZER, which is actually a lot, but it's more the engagement, like the behavioral science behind it, as well as the gamification, and to engage someone into an environment, right? Yeah. So I think that's like a big hurdle that I think you guys achieved, was well, let's convince this patient to use it or these clinics to use it and then see the outcomes on the other end. So I think that's like a huge win. I think that's like one of the most incredible things is getting the behavioral change to happen and the gamification and changing the environment, which is, I think, pretty cool.
Yeah, we hear a lot. This is fun. I love doing TRAZER. It's lots of fun. And if you can get the data analytics and the measurement constructs on the back end that kind of gives you some scorecard of your vital performance, where you're limited and what you're doing great at, and then be able to home in on the predictability, the preventativeness, and then to prescribe, that kind of pulls all those performance metrics together and helps to prove the value of what you're providing them over time. And they get on-demand feedback. It's right there in front of them.
Yeah. So you mentioned, Eric, you mentioned value-based something. Yeah, you said value-based. Okay. And what most people think about with value-based is an insurance company paying in a different model than we currently do in fee-for-service. Now, is that something that TRAZER is? I know that you're not trying to establish contracts with insurance companies, I don't think, but is that something that your clients are trying to do? Or do you see an even further out of the box application for the information that your clients are getting from TRAZER?
TRAZER has really been a value technology partner to the user, being usually a healthcare, an athletic trainer, exercise physiologist, physical therapist. And so we've really been a partner for them to be able to give them the tool set to be able to go and negotiate their rates, to be able to go and negotiate on behalf of their patient the need for ongoing therapy services.
Yep.
To date, we haven't directly tried to have contracts per se with insurance companies, but it's not outside of our realm for where we're growing to and what we're trying to bring to the insurance payer market. We have a plan for that, but it has early been an adopter from the therapy provider or the healthcare provider side.
So full disclosure, we are, my company, TelePT, is partnering with TRAZER to work on falls prevention programs and potentially go down that road, but also look for other opportunities to simply by bringing value to a membership of whatever sort. In our case, we're looking at falls prevention, which we've talked about, right? How do you see that? Do you want to describe how you see that working?
Yeah, absolutely. I'd love to talk about that. Falls is a passion project for me, to be honest with you. It's a leading cause of early death for seniors over the age of 65. It contributes to a tremendous amount of health impact for seniors. And so when I was with Motion and when I was with Aegis and with Next, we kind of worked through the process of trying to reduce falls. So we did some white papers and some outcomes, and we used TRAZER as a technology partner to be able to validate and measure the data to prove that we can make an impact in falls. So we were able to show a 36% reduction in falls in senior living communities that integrated TRAZER for prevention, so baseline testing, and then used it for intervention to be able to improve the risk population of seniors that were at the greatest risk for falls. So we felt like that was a significant impact. And we talk about value, we talk about healthcare. That was $3.5 million of healthcare savings for each community when you look at what it costs for a senior to go into a hospital with an injury, right? So in partnering with you, I think it's a great opportunity to not only look at TRAZER as a data source and the protocols that have been validated by a lot of different research groups, but to be able to integrate that remote telemonitoring and the remote telehealth services that TelePT Solutions offers. Yeah.
And I know you're implying this, but when you say impact, it really, think of the lives it impacts.
Absolutely.
If you can bring a falls prevention program into a community of 1,000 people, and you can prevent even a couple of falls a year, that changes a person's life. It changes their family life. It changes the dynamics around them, and of course, saves everybody a significant amount of money. I think $40,000 per fall potentially. Have you? So, what kind of results have you gotten from the falls prevention programs that TRAZER, the research that TRAZER's done on falls prevention?
Yeah, so we looked at a couple of different measurement constructs. We used CDC guidelines to look at what are the greatest predictors. So we look at feet per second, so speed, distance over time. So we look at anything less than 3.28 feet per second is a risk factor, right? So we're measuring speed. We're looking at acceleration and deceleration. Deceleration is another measurement construct that we measure at TRAZER to look at, I hear this often in the physical therapy world that ambulation is nothing more than controlled falling, right? So we're able to dynamically hold ourselves in vertical space with gravity pushing down, and we're able to stabilize, right? But when you lose that ability for a variety of reasons, then you end up falling. And so if we look at deceleration, so seniors get up and go, right? Like they get up and go, but they have a hard time stopping, and that's where falls and injuries occur. So we look at deceleration, and then we look at reaction time. The brain's ability to see an environmental stimulus or respond to an environmental stimulus and then move to abate or mitigate a risk factor that might be involved. So reaction time greater than 1 second is another predictor of falls indicator. And we are able to measure that brain and body performance simultaneously at TRAZER, which we feel is one of our greatest impact potentials in that space.
Yeah. And I recognize that TRAZER it's an evaluation tool and it's a treatment tool, right?
It is.
Gamification treatment tool.
Yes.
Sounds like what we do.
Yeah, exactly. Well, and I've expressed
or treatment, both.
Yep.
Exactly. And it's not the intent is not to eliminate the therapist or eliminate.
No, not at all.
It's a tool for them to use, and for our purposes, we're actually looking at it strictly for evaluation and assessment, to be able to segment the population for patients who are, or members of a gym or members of a community that are at high risk for fall, moderate risk for fall, or at low risk for fall. And those that are at high risk, they're going to get more advanced interventions, maybe hands-on interventions. Moderate, they're going to get more of a telehealth or remote care intervention, and minimal, they can do probably a self-guided intervention or program. So, I think that there are a lot of applications for it. And we already have interest. So it's been exciting.
Well, it's really the iceberg phenomenon. I mean, we're really just scratching the surface of what we can do here and the level of care that we can provide with remote telehealth services and being able to reach a spectrum of individuals that otherwise might have been excluded because of geography, because of financial, but because of access. This kind of eliminates that access and this resource component by giving them another tool through innovation and technology to stay connected.
Yeah. Yeah. So what do you see for TRAZER? What do you see as the big opportunities or where TRAZER can make their biggest impact in the next 5 or 10 years?
Man, we do an ideation session on Fridays, which is where we come together as a whole company, and everybody has an idea. Everybody has a say. Everybody gets to share their vision and their ideas, and we write down all of them. They can be as grandiose, or they can be so finite. They can be macro or micro. It doesn't matter. There's no right or wrong. It's just bring something, right? Yeah. And it's so creative. So I can't spill all the beans, right? But I do see our ability to bridge the gap through interoperability to connect providers with consumers and healthcare payers, to bridge the gap between communication and data and being able to be predictive and future. We talk about prevention and we talk about wellness, but it's oftentimes bastardized and it's not utilized in what I think is the correct variety and verbatim or vernaculum. But I think that TRAZER has the ability to connect those dots. And when we add our telehealth component to it, we will solve for a great majority of the future healthcare problems that we're starting to see in our industry. But to be able to communicate from one point of contact to the end point of contact with all of the validity along the way is going to make for a better healthcare outcome for our users.
Yeah. I mean, communication is always a challenge, particularly in rehab. We're kind of at, as you said, like one end of the communication line, and even the information that we get is often butchered.
Sure.
So if you can close those gaps and in both directions, I think, the patient benefits. And of course, you create efficiencies and you decrease frustration of the provider.
It will. And I think as we move into prevention and wellness and we get away from just pure intervention, I have a vision. I've shared this before, but TRAZER will be a smart home device in the future. It will be connected to all of your wearables. It'll be collecting your biometrics throughout the day. It will be predictive, preventative, and prescriptive, and giving you advice towards wellness, things that you should be doing from a behavioral perspective, things that you should be doing from a wellness and activity and performance perspective, things you should be doing from a nutritional perspective based on your biometric feedback. And we'll be able to be a part of that industry and continue to lead it.
Now, I love that. And I could see myself using that.
Yeah.
But I could also see other people being very concerned about Big Brother.
Oh yeah, absolutely.
Like that. So how do you I don't know if you've addressed this or not, but and that is, anytime I've thought about it or read about it, I know that there's going to be pushback in that respect. So
always.
What's the conversation
people
around
are always
that?
going to be concerned about security, and being in a law enforcement world, I get it. I get concerned about it too.
Sure.
There could be people listening in on this conversation, right? And there has been hackers and YouTubers that broke into Zoom during the pandemic.
That's right.
Some smart board people out there who are really creative. But I don't know if you've ever read the book Crossing the Chiasm, right? And it talks about innovation. Okay, so it's a great book. It's disruptive innovation, and so they talk about early adopters, the visionaries, the ones that are going to go right out because they really believe in this. They have this great vision and they're going to early adopt any kind of technology that's out there. And then you're going to move right into the early majority, right? And they're the ones that are going to want to see it proven out a little bit. It's really going to have to meet their needs. They want it to be a little bit more perfective. Then you got the later ones, right? They question everything. They're not quite, that's going to be your security risk people, right? They're not quite sure yet. And then you got, the end group, which is really the laggards. And they just really have to, it has to be an absolute necessity before they adopt this type of technology. So, but the early adopters, they're the 80%. They're the majority buyers of innovation and clean technology going forward. So that's kind of our market group. And then we know that through innovation and technology disruption that eventually it'll become a necessity. Eventually other people will want it. It's like your technology today that you can control your air temperature in your house off your phone with a Nest, right? But you can also turn your lights on and water your yard and turn on your alarm system and feed the dog. There's people who already have that today. Those are the early adopters. This is just another generation of different innovative techniques that are going to be disruptive.
Yeah.
I think it's also like something that's not going to be an issue because we already do it. I mean, social media, they've got our data. When healthcare, hopefully with crypto and blockchain, we're going to have a lot more security so we can do that. But I don't think it's a question of if, it's a question of when. Is the wearables collecting all our data, our movements, the smart devices, the TRAZERs that are being in the corner of my wall over there, just detecting all my movements and being like, hey, your left hip is antalgic. What's going on? Here's what's the data. So I think it's a matter of, it's just a matter of when. So I don't think that's going to be much of an issue. If it saves money as well, and it saves headaches and problems and admissions into hospitals, I think people are going to sign away their information. And if not, doesn't matter. It's going to happen anyway.
Just think about the number of family medicine doctors who are late to the equation. People wait too long to go and see their family medicine doctor. So they're already in crisis. They already are sick. They already have something going on with them. What if their doctor was getting on-demand information from all of the TRAZER users that were out there, and it was constantly uploading their Epic system and constantly uploading their EMR, and it was already giving them indicators, hey, so-and-so is at risk of a fall. Maybe you should reach out to them. So-and-so is at a risk of an ACL injury because they have these kind of biometric issues and asymmetries. Maybe you should bring them in for an early evaluation. Maybe this person's having an endurance issue or a cardiac episode, and they're showing it throughout their metric performance that we're measuring because they're engaging functional activity, and they're giving those alerts into their physician. Talk about saving money, time, and health. All these things are predictable.
I guess my question, I mean, Eric, you would know more, but I think the challenge would be the servers, how much data is being accumulated. Can physicians on their end have servers that feed them the data? Can you guys have a cloud system that has all this space to store all this stuff? That's my question is will the physicians and the healthcare providers have enough space? It's even my Google Drive, right? I do a lot of video and content.
Isn't data is getting cheaper and cheaper?
And it's right. So that's what I'm saying is
you can buy more cloud space. Yeah, absolutely.
Correct. So I think it'll be so exponential, the amount of data, that I don't know if the servers and the just the amount of data you can put, I think they're getting smaller and smaller, even SD cards, and they're getting tinier with, I don't know, hundreds of thousands of gigs of data.
Adrian,
So
why don't you let the visionaries have their vision moment here?
Listen.
I'm just curious what their thoughts are on that.
These are great conversations that are being had by incredibly smart people right now, where they're not only looking at Azure and they're looking at cloud, and they're looking at Microsoft and Google and Apple and Amazon is getting into this. All these big tech companies are getting into this dynamic conversation that we're talking about right now, and they're already developing solutions for this, and they're going to be coming out. It's just a matter of moments that we get to a point where the market is ready to listen to something new instead of dealing with all the crazy that we've been dealing with. Because the things that you're talking about, they exist today. We've had early conversations with these companies. They've already come to us and talked to us about these things, and I know that they already exist. The market needs to be ready for this, and those early adopters are going to get in on it. And it's going to be like when somebody came to my dad years ago and said, I want to talk to you about this little bitty circular thing that you plug into a computer and it stores all this information into a hard drive. And my dad's like, that'll never happen. Right? That was a CD-ROM. Right? And now they got things that are the side of our pinky going into a computer and storing, gigabytes and mega, so it's out there, dude. Exactly that, right? Little SSD cards that are so flat, and they get smaller than that. So
yes. So like I said, it's not about a matter of if, it's when, right? I guess for me, I guess I'm also passionate about speed, right? But like it's the small physicians in the rural America. That's what I'm wondering. Like, yeah, the big companies, the University of Kentucky hospital system can do it, right? Even though they're way smaller than Columbia or NYU, but they can do it. But I'm talking about Dr. Smith, who's on Main Street and has one or two practices in rural America. That's where I'm like, the massive market adoption is, that's what I'm curious about. So listen, I'm not an acer. I believe
no. It's real. So what does a small town doctor with limited real estate in their practice do when they need to offload their paper charts or their old equipment? What do they typically do? They buy a storage facility, right? And they offload it for a small dollar fee per month. Back to Dan's point, data and storage management is becoming so inexpensive these days because the market share is there, right? So I think what's going to happen is you're going to have these big storage clouds and even smaller ones and brokers that are going to be offloading and helping these smaller rural areas be able to offload for small amounts of fees to have all this data storage and be able to broker from them and to be able to bounce off of and do that. I don't know, maybe, but I think that's going to be.
I agree with you. And 5G internet is definitely going to change things too, from what I hear. That the speed of everything is going to be moving faster. If everything's connected, you need more speed, more connectivity, right? So that's bound to happen in the next couple of years too.
And we'll be way beyond 5G by then, right? Like there'll be the 6G and the 10G by then, right?
6G, 6G.
We'll be on Mars. We'll be on Mars, and we'll be offloading stuff to satellites.
That's right. You'll get the information before you even ask for it.
Yeah, just ask Tesla.
You mentioned you mentioned blockchain. What do you guys have any plans?
Adrian mentioned blockchain.
He did.
Yeah. I can't talk about blockchain. That's not my expertise.
Oh, okay.
Yeah.
No, I think that, definitely not my expertise either, but I imagine that at some point encrypting a patient's data or a patient's information will be on the blockchain. And I'm sure that the technologists at your company are probably thinking about that already.
That's probably one of the biggest questions that we get from the large healthcare systems. And mind you, we also do business with military. So, and they are the most secure, and they have the most stringent security parameters. And we have to adapt and compensate for some of that already today for that encryption and for that safety and because of the type of information that's being exchanged. So our engineers are already working through those processes today. And it seems like every time we add a new customer, we have a new challenge, and we continue to build off of that. So I don't think that's ever going to stop. I think we're just going to have to continue to adapt and adopt new strategies and bring on new talent that has those expertise behind there.
For sure. I like that about your team, is that you're very agile. I mean, I know that word is kind of overused in the tech world, but I think you guys just think you're not so committed to any idea that you won't adapt to a client's needs.
I will tell you that Barry, our CEO, is adamant about being nimble and being able to pivot. And as much as he wants to grow and as much as we want to expand, and we're going to do that, we're a small tech team today. What we like to do it all in-house. And I get requests every day on LinkedIn for tech companies to want to outsource and all this. And my go-to answer is, thank you so much. I love communicating with you. I'd love to follow you online. But our CEO is adamant that our tech services and our engineering will be done in-house. Why? For quality assurance. He's adamant that we control quality. We control the algorithms and we control the outcomes, and that we can do that in-house, and that we can be so nimble that we can meet the needs and adapt to our customers' response immediately and be able to get it to them in a timely manner. We don't want to book things out months and weeks and years out. We want to be able to meet their needs today. And having that control mechanisms in-house has been part of our success.
Yeah. Do you ever sort of get the itch to grow bigger, faster?
Oh, absolutely. I
kind of know you.
You know me because
I know you, Eric.
Healthcare practices that have thousands of clinics, right? And I've opened thousands of clinics and managed thousands of clinics, and I'm used to big projects and growth. I'm proud during COVID, we launched in Singapore, we launched in Italy, we launched in Germany. And so just to know that it's not just in the United States that have an interest in TRAZER, but around the globe, that we have this global opportunity, that there's really no ceiling for what we can achieve through TRAZER. So yes, I have an itch to grow as fast as, but I can only grow as fast as the market demand will and the cash flow that we have and our tech team's ability to
is TRAZER available in other languages?
So we actually do have TRAZER in other languages, and our tech engineer is working today on adding additional languages for TRAZER, which is going to be super cool. So we're getting ready to launch a new version of TRAZER Plus coming up. And then we'll have the 2.0 version of that's going to have those advanced features. So I'm excited, including Arabic. And I know Tracy's listening or will be, and she's going to say, it's so easy. And she does. She makes it sound so easy, and because she's super smart. So.
Nice. So what do you see as the biggest challenges for you and healthcare tech in general in the next few years? We already talked about security. I think that's one of the big ones. What do you see in the near future for TRAZER and other healthcare other tech companies in healthcare?
I'll speak directly to TRAZER in that I think the same barriers of the past will continue to be potential barriers of the future, and that is the intellect of our patents and intellectual property exceeding the current technology's capability of keeping up. I mean, we already have additional provisionary patents that we've applied for that we're not going to be able to get to until certain technologies keep up with us.
Yeah.
So I think intellectual property and the overall software hardware capability, and we will eventually be hardware agnostic. And so where we're growing is going to be super cool. I think like any organization, cash flow, you got the demand and the growth potential. We got to have the cash flow and investor capital behind you to be able to continue to grow and expand to the level that I'd like to see it and the level that our C-suite team wants to. And then, there's always going to be the legislative and lobbying component. What are going to be the necessities and the demands and the regulatory barriers or guidelines that we have to overcome? Telehealth is one of those things. Is it ever going to be paid for? Is it going to be globally paid for? Is it going to be paid for at a rate that therapists deserve? Or is it going to be, direct to consumer, and the consumer is going to have to bear the burden of those costs? Same as anything else in healthcare tech. And for today, it's all about, can you make it any smaller and can you make it any faster, Adrian?
That's right. Yeah. I believe that the healthcare insurance system is broken in many ways. We've seen that in the past year. It's really been, it's one of the biggest challenges policy wise in this country. But the insurance companies, they have a lot of the money, they have a lot of the lobbying power, and they basically control healthcare. How do you see it changing or evolving? And I know you've put a lot of thought into this.
Man, that's a loaded question.
Well, it's also, it's a multi-level question, and I don't want you to bash the insurance companies.
No.
But where do you see the typical
have a place? And I will say this: that the larger insurance companies today are moving. Surprisingly, you're going to hear me say this: they are moving to a wellness model. They are adopting philosophies that are 15, 20, 30 years old in my career that we've been talking about for a long time. But I think you're going to start to see insurance companies going into the healthcare delivery of services. They're not just going to be payers, but they're going to actually own the delivery models. They're going to want to continue to control the cost and the delivery of care, and they're going to want to own the data. So data management, data aggregation is going to be their key focus if it's not already today. They want to be able to control you from birth to your oldest age and through hospice services. And they want to be able to manage that data along the way. And they want to keep you in their system versus getting outside of their system. They're going to own hospital systems. They're going to own those family rural physician services. They want to control the mechanism of data flow. But I also think that they're going to be starting to hold practitioners more accountable to the value of the services that they're delivering. And they're going to start encouraging practitioners, even within their own practice, and they're going to measure you up. Your outcomes are better than your colleagues' outcomes. You're going to get paid at a higher rate.
Yep.
And you're going to force practitioners to be better deliverers of service and be able to validate more objectively the services that they're delivering. It's not going to be just down to range of motion and pain anymore. And I think they look good. You're going to have to really prove it. And I think they're really going to hold us accountable to it. And we better have the data to support it. And that's why I got into the business that I'm in today.
Yep. I mean, we've been hearing that for a long time.
I know we have, but it's not that it doesn't exist. It's existing in certain markets today. It's already being used in pilot program. It's already being mandated in certain states, and it's already being adopted by certain providers. And the more that buy into it, the more they're going to show the necessity for it, and they're going to make it part of that, necessity you're going to have to do. It's not going to be an option.
Yeah. I truly believe in what you said about an insurance company wants to, they want to take ownership and responsibility for a person's life. But at the same time, they have no guarantee. And I used to think about this all the time as a practice owner, that why would an insurance company pay me more for better care over the long term if they know that their patient can get bad care or whatever care for a lower price down the road? Now, if they were vested in their patient's life for the long term, then they would care. Right? Then they would care. But if that person's going to leave their job in before the end of the year and go to another insurance company, why would their current insurance company invest in their health for the long term? So, but the flip side of that is them owning, like, who's gonna commit to an insurance company for the long term as a consumer, right? And then you're talking about Big Brother again.
No, that's I think where they're going to get into the healthcare management and ownership of healthcare practices. So it's not about you staying with an insurance provider. If you want to stay with your provider, then by default, right? The philosophical discussion. There's 5-star ratings, there's risk share agreements, and there's regulatory guidelines that are somewhat holding these folks accountable to better outcomes. Maybe not the better delivery of care. You can debate all that, outcomes and delivery of service. But I think if you can measure your outcome potential and you can show that you're reducing the cost of delivery of service and care, and you're reducing catastrophic injury, and you're reducing the complex disease management issues that cost payers the most amount of money. I think that's where you're going to be in those opportunistic positions as a provider, regardless of your discipline, to be able to partner with payers. There already exists today. It just hasn't really trickled down to the physical therapy world yet. It already exists in the family medicine and the kidney disease, dialysis, and the heart disease, and all those complex specialties. Just hasn't really hit us yet, which is surprising because musculoskeletal injury is one of the greatest drivers of cost in the healthcare spend. But the insurance companies haven't quite partnered with us successfully yet. And I think it's really some of our duty as musculoskeletal practitioners to be able to prove our value. And you know what? Honestly, we haven't really done a great job of that as a profession. We talk about it,
true,
but we haven't really proven it. And I think that's really up to us as a challenge as practitioners, licensed medical professionals, to prove our value and go and partner with these payers. It's not going to be easy. I've been trying to do it my whole career in legislation at the state level, but it can't be something that you just push to the side and say, well, that's never going to happen. That's not how shit gets done. It just doesn't change when you do that. You got to keep pushing.
Yeah, I think you're right. A lot of research in PT is driven by academia, and there's a disconnect between academia and private practice or industry, corporate side of medicine. I agree.
Totally agree.
Particularly in PT. So we need to partner up with our buddy Mark Campo, who's a professor and researcher at Mercy College, and I know you guys have a research partner who does a lot of work. Who TRAZER does a lot of work with. I mean, that's a really good way to get things done. I agree with that.
I think the success of TRAZER over the years has been their attachment to research and science, and really letting those really bright individuals do the math and be able to come back to us and say, yeah, this works or it doesn't work. But if it does work, this is how great it is.
Yeah.
And I think we deserve that as a profession. We deserve to have that research arm to go out there and speak on our behalf. And we need those legislators to be able to show that data and be able to show our value. We can't keep getting cut down year over year and how much we get paid, and then still be a profession with a license and be able to compete at the top level and then be able to give the care to customers that they deserve. It's just it's not going to be sustainable.
I've been working with a telehealth lobbying group and a telehealth legislative group, and they're gathering research across the spectrum of healthcare. And I've been having a really hard time finding research and data on PT rehab in telehealth. And I haven't been collecting data on a large scale. I mean, I don't have the platform for that, but nobody is.
Well, it's interesting because you and I started working together at Motion PT, and we really just started launching telehealth and accelerating it because of COVID, right? Like there was all of a sudden a massive necessity that if you want to get a paycheck, you're going to adopt telehealth, right?
That's right.
Because clinicians just innately didn't want to do it. There's 1,000 excuses as to why we didn't want to do telehealth. It's not personal. We don't get paid for it. I can't put my hands on my patient. It kind of dilutes our value. Like you and I both heard it, right? 600 plus practitioners, we heard it all. And it wasn't until this necessity, right, back to early adopters, back to laggers. I think a lot of the PT, OT profession were laggers when it came to telehealth as an innovative technology solution for patient connectivity. But this pandemic hit, and they didn't really have a choice. I remember getting calls on a Sunday from competitors saying, dude, you guys have already launched telehealth. I've got to launch it by tomorrow. What do I need to do? Right? Because their practices were closing. So I don't know that we had a lot of data to aggregate and to bubble up and do research on prior to 2020. I mean,
Sure.
I was...
No, there's very few. I think I knew every telehealth PT in the country before 2020.
Right, which was like two hands full, right?
Pretty much.
Right,
Pretty much.
exactly.
Maybe less, yeah.
And those guys were getting made fun of, and those guys were getting talked down about at the professional level. Now they're being like, well, you guys are the best. You guys are
yes and no. I mean that the wave crashed, and people are scurrying away from, or practitioners are scurrying away from telehealth. Some are adopting it and using it very effectively, and like us. But there are a lot of people are resorting back to that, or reverting back to the old mindset of, I used it when I needed it, and now I can go back to what I was doing before. I mean, there's still the wave is still growing, meaning that it's coming back and it's going to continue to grow.
You know who I think the greatest driver of telehealth services in the future is going to be? It's not going to be the healthcare delivery person. It's going to be the consumer.
Absolutely.
They're going to be demanding it. They're going to be, look, I want to come and see you, but it needs to be on my time and in my space and in my convenience and the comfort, and driving downtown and trying to find a parking spot and getting my kids off to school and meeting all these demands. I love you, Dan, and you're a great practitioner, but I need you to call me, right? Like that's going to be the future of telehealth, is going to be a consumer-driven model, and they're going to be placing the demand on the provider. And if you're not a provider of knowledge at this point, you better be, because it's coming.
Yep.
I do. I hear it in the circles that I'm within, outside of healthcare, just in the consumer world, and with my daughter's friends and people who ask me questions in a variety of different professions. They're talking about telehealth. Yeah. They're like, I love it. This is so convenient. It's so easy. I get one-on-one with my doctor. I get one-on-one with my therapist. They can teach me stuff in my home. This is great. This is going to be the consumer-driven model of a lifetime when it comes to healthcare. Yeah, I believe.
How are you guys integrating telehealth with TRAZER?
Yeah. So when pandemic hit, senior living communities were shut down and they were shut out, and family members couldn't stay connected. And so that was a concern for me. Again, falls were going to go up. Sarcopenia wasn't going to get any better because people weren't active. They weren't getting out. Social isolation and mental health issues. And we saw all of that blossom. Pharmacological going up, mental health going up, falls going up. All of the things that we knew was going to happen had happened. I talked about this on a dozen plus shows, right? So I went to TRAZER back. I was a customer, right? I said, look, I need to stay connected to my 150 residents in a senior living community, and my practitioners need to stay connected. The therapist can remote in, the patient can walk down the hall with the nursing assistant or the nurse or ambulatory independent, go turn on TRAZER, be on video with their therapist, and be able to have a connectivity. That was kind of what I needed. That was a necessity, right? It was a demand need. So TRAZER is launching their Connect platform, which is our virtual platform for athletic trainers, personal coaches, physicians and therapists to be able to stay connected with our users and be able to watch their performance, be able to give them prescriptive ideas about their performance on TRAZER, where their asymmetries, where their barrier issues are, and to be able to integrate that through our platform and be able to use it not just on TRAZER, but in healthcare connectivity in general, and to be able to stay connected to therapists. Even if you don't have TRAZER at home today, you will in the future, but today, you'll still be able to stay connected to your practitioner who's going to pull your data from the cloud, tell you what your needs are, and then be able to prescribe not only TRAZER activities, but additional therapeutic interventions that you need to be able to do in order to achieve your healthcare goals. That's awesome. TRAZER Connect.
Awesome. And I mean, the data component of all of that is so powerful, right?
Yeah. Therapists didn't have to be there to collect that data. We didn't have to put a goniometer on it. We didn't have to give you a dynamometer. We didn't have to use a tape measure. Awesome. The AI told us what those metrics are and then delivered it to the cloud. We pulled it down administratively in a HIPAA compliant environment. And then we have a face-to-face on a call like this with our patient. And we walk through what their experience was.
You like that, Adrian, don't you?
Yeah. Right. It's cool.
You like that.
Yes, very much.
Eric, I mean, you are definitely the best person to explain all of these things. You may not understand the technology. You may not be a tech guy, but you definitely know how to apply all these things. And I mean, the way you describe things makes it really clear I mean, the first time you told me about it, before I even saw it, I was like, that's the coolest thing I've ever heard. So I hope everyone else feels the same way when they're listening to you explain it. Do you have any questions for us? This is your chance.
Yeah, I love that you're doing these podcasts, and you and I have known each other for a few years now in a variety of verticals, right? Telehealth, senior care, workers' comp. Where are you going? Where's your vision of where you want to go with TelePT? Because you're kind of a guru driving.
I knew you were going to ask me that question. I know, and I knew I wasn't going to have a good answer either.
No, you are. You're going to have a good answer because you and I have had these offline conversations. So I kind of understand. But your business is evolving, and your vision is evolving, and your network is evolving, and you're driving this great passion. And I know it's passion, right? I know this is something that you're really passionate about. So you asked me about TRAZER and my passion, but I'm really curious, what's your passion with this? Where do you want to see this go?
Well, I'll start real small with what we're doing right now, this podcast, and I write a newsletter. I just really like hashing out my ideas. So, and hearing other people's ideas, learning from other people. So this has been already, this is our 13th episode, I believe. Already it's been a tremendous experience for me, and I think for Adrian as well. So I really enjoyed this part of it. And I expect that, of course it's a platform and it's a marketing tool and other things, but I just really enjoy the path that it's taken me down. As far as professional and more clinical side, I want to innovate in this space, man. I want to bring telehealth, rehab care, PT, OT, speech even. I mean, I'm a PT, so that's really my focus. I want to bring it to anyone and everyone that's interested in it. And I think that there are so many applications for it. There's so many uses for it. And it's not just PT, it's PT wellness. And as you said, I've always been of the mindset that you don't have to be injured to see a PT. Right. You don't have to have fallen to have seen a PT. If you're at risk for a fall, or if you're training for something, you should be in contact with a PT. And the fact that we can get the kind of access, and patients can get the kind of access that we can offer through this sort of platform, telehealth, using technology, using data to gather information and take us, like, really make an efficient and productive experience. That's what I want to do. I want to be in the middle of all that.
I definitely see you in the middle of all that. I definitely see you driving that. And there's nothing more powerful in the clinical perspective than the therapeutic use of self. And that ability to engage with a professional with knowledge and experience and background in any environment, that's the power of therapy, right? It doesn't matter if you're hands-on or in a clinic. Those are benefits, and that's great. People need that. But just to share ideas and to bounce ideas and to be able to prescribe information and to share education and be able to listen to your patient, you have to be in a clinical environment for that, right?
Yep.
And so I love it. I love it.
And you know, I focus on what I do have and what I can do, as opposed to what I don't have and what I can't do. And telehealth is it's the definition of that, because as so many PTs say, what about the fact you can't touch the patient? What about all these, whatever, there are so many advantages to this environment. Just the engagement. I mean, I find the engagement to be it's actually more of a connection with a patient when you're one-on-one with them on a video. It really is amazing. And you can still go meet them if you need to.
Absolutely. Or you can have a network of those manual therapists that you can recommend and outsource to, right?
That's actually more realistic. Exactly.
Here's my goals. Here's what I'm capable of. If you need this, I'm going to refer you to these professionals. And so it builds a better model, I think, because you're working together in synergy for the benefit of the patient.
Yep. That's it's always been a challenge in, my world has always been private practice, and private practice is competitive. You're competing with the guy down the block, you're competing with you're competing for referrals from a doctor. But I've found what I'm doing here has become much more collaborative, much more cooperative. I mean, the opportunities to work with people like you one thing I like about TRAZER, you guys are very cooperative. You're looking for partners. You're not looking for clients. You're looking for partners. You want to work with groups on what they want to do. And, connecting with someone like Kevin Kruger as well. And, developing a network of providers where we can do the best for the patient.
That's it.
That's so cool to me. That's so cool.
I think that has to be the motivation, right? It has to be for me. As a clinician at heart, my motivation has to be whatever I'm doing has to be at the core, the benefit of the patient.
Yeah.
Everything else falls in line after that. But if you surround yourself with people with that like-mindedness, the outcomes are only going to be positive, right?
Yeah.
Because it's the right intention with the right focus and the right mission, with the right value add. So.
Yep. Well, thanks for the question. That was a good one.
Yeah, it's good. What does burn on your shirt mean?
I think it's a brand.
Are you on fire?
Yeah. You can't tell.
You're on fire.
Yeah. Adrian, you have anything else to add today? That's your question.
I'm staying a little quiet because there's a little party outside. As you can tell, the salsa and bachata are off the hook tonight.
Hold on.
The weather's getting warmer.
Let's let it run for a second.
No. We want to hear it.
Yeah, I know. Unmute yourself.
And it just went away. Sorry about that. No, I think it's fascinating. I think we're all in the same. It's really cool that we all have different trajectories how to get PT, OT, speech accessible to as many people as possible. And so I just like this as well, that we each had a different. We have a vision, we have a passion, but it's all servicing a different kind of category, so to speak.
Yep. Awesome. Yeah. Eric, this has been a treat. Always great talking to you, man. And I'm glad I hit record.
I'm glad you did too. That's good.
Hit record. Have a great Derby week.
Thank you.
I'm jealous. I need to get down there for
make it a Derby. 2022 goal, dude.
Man,
come down, be my guest. All right. Stay in my house.
TelePT live from the Kentucky Derby.
There you go.
That would be pretty cool.
Yeah.
All right, man. We'll wrap it up. And
Thanks,
we'll do this again sometime. Thanks for coming,
absolutely. Man. I appreciate it. Thanks, gentlemen. Appreciate it. Have a good night. Stay safe. Be healthy.
I hope you enjoyed this episode of the TelePT Connections Podcast. Thank you for joining us. You can find Adrian and me on Twitter and on LinkedIn. Also, please check out my website. It's TelePT, TELAPT.com. Remember to subscribe to this podcast, the TelePT Connections Podcast, and tell your friends. That's how I find all of my favorite podcasts. Next week, we're going to be joined by my good friend, Dr. Mark Milligan. Don't miss it. See you then.
We hope you learned some things to help you connect with your musculoskeletal system and more. Find us on Twitter at dseidler, that's DSEIDLER, and at Adrian MPT, ADRIAN MPT. And on LinkedIn, Daniel Seidler and Adrian Miranda. We'll connect with you again next time.